Live. Here we are to have a very important conversation this evening, and our guest is going to be Dr. Joyce Choe. And I can't wait to introduce her in a moment. I'll tell you right now what we're going to be talking about. We're going to be dealing with autoimmunity, strategies to manage it. So I just want to welcome each and every one of you to the program, as always, and you can have that conversation in the chat as we continue. And Dr. Joyce and I will be talking momentarily. But did you notice half the people around you right now have got a sniffle? Got to spray this stuff up there even before it starts to really hit you when you first feel it. I won't tell you the main thing in that Revita sinus, but head on over to the Living Springs Retreat store. Follow that QR code. If I name it, some of the platforms have certain things that you're not supposed to talk about. You're going to go like, oh yeah, that's what's in there. I need that stuff. It's also got iodine. Same thing that the Revita Guard for the throat. I usually feel it in the throat first. I was literally spraying that just yesterday because stuff is going around. And then, of course, the Revita hands. Try to do prevention without using the alcohol-based hand sanitizers. These smell so nice with the lavender. There's different flavors you can try. Flavors, no, don't eat that one. Different scents at the LSR store. So that's our sponsor today. Thank you for the Revita Living products at the LSR store. Dr. Joyce Choe, MD, MPH, is a board certified ophthalmologist. She's also co-founder of medmissionary.com. That's a ministry that was formed to help heal, particularly their fellow Christians and their Christian community, there to serve all people from all backgrounds. But the idea is for Christians to be able to fulfill their purpose. It's a mission to help bring healing to those who are on a mission for Jesus Christ to prepare the world for his soon return. So very much in line with the mission of LSR is medmissionary.com. So I'm very glad to welcome Dr. Joyce Choe. Thank you for being with us to talk about autoimmunity. Now, for the layperson out there, they may have heard this autoimmune disease. So-and-so has an autoimmune disease. Can you give us just kind of the basic definitions so we all know what we're talking about this evening? What is an autoimmune disease? What are some of the names of some of them, and what make them all autoimmune diseases?
So thanks so much for having me, Scott. It's a privilege to be here. And a very simple answer to your question is that autoimmune disease is when your immune system that has been designed to help fight infection and to be able to identify bacteria, viruses, and these types of things, when it seems that this immune system appears to be turning against self and cells in the body. And so there can be a number of different autoimmune diseases. Some of them probably haven't been diagnosed yet because you can have an autoimmune condition against any type of cell in your body. Right now, there's more than 80 autoimmune conditions that have been identified, some like rheumatoid arthritis, multiple sclerosis, diabetes type 1, polymyositis rheumatica. These are all pretty, or lupus. Lupus is probably something that a lot of people are familiar with. And now I think in the last 4 years, we're seeing an even faster rise in people developing autoimmune conditions.
So the number of autoimmune conditions that are being identified continues to rise over time. You said there are 80. I did not know that. I knew the ones you named. My wife's actually been diagnosed with Hashimoto's. We can talk about that one too. But 80, that is pretty serious. So you got into helping people with many health problems and giving lifestyle coaching and advice and cookbooks. And tell me about your journey into honing in on this autoimmune disease topic. That's really where your specialty has become on Med Missionary. How did you end up focusing on autoimmune disease?
That's a good question. How I got into helping people live more as medication free as possible. It came out of my own journey. I grew up in the Seventh-day Adventist Church, and as many people know, we in the Seventh-day Adventist Church, we really believe that this body, this temple that God gave us, this is where we worship the Lord. And so this is one reason for why we believe in keeping it as healthy as possible so that we can hear God's voice more clearly. And so growing up and knowing these things, I really thought that going into medicine, that it would be a good way for me to learn more about this and to help other people in this way. When I got into medicine, I think that was the first time that I even started taking antibiotics. I was put on a sulfa medication as soon as I got into medical school, based upon a physical exam that I was given to enter, and had side effects with that. But the biggest thing that happened to me was that I was put on a powerful new antibiotic. It's in the fluoroquinolone family. Are you familiar with fluoroquinolones?
No.
So, are you familiar with ciprofloxacin?
I've never taken antibiotics unless maybe when I was a kid and I don't remember it and it just, you're a kid and you don't really notice things. But my wife and I just went like meds free 20 years ago. So all the names of the meds, it's like Greek to me. You MDs, you're just
Yeah.
like, you got all this terminology. Help our audience out with the antibiotic types here.
Well, the reason that I mention it is because it's a very commonly given antibiotic, especially if you go on a mission trip. A lot of people will bring ciprofloxacin with them and they'll leave it behind for the people. And a lot of times when you leave these meds behind, you're just thinking, I'm going to leave behind something that's pretty benign. And, you'll take it if you get, food poisoning or this kind of thing. And, I was put on a fluoroquinolone that is in the same family as ciprofloxacin, but it was a newer generation, and it caused me to have progressive weakness over time. And in later years, I thought, I haven't heard of that drug for a long time. It was called trovafloxacin, and it was taken off the market within a couple years of it being put on the market because it caused liver failure and death in too many people. And what it caused for me, as I said, is that it caused that progressive weakness. It is a mitochondrial poison. It will change your DNA, apparently. And there are people who will take just one dose of a fluoroquinolone and they will end up being disabled for life. And so I consider myself very fortunate to be someone who just had the issues that I have. It set me up probably for the multiple issues that I struggle with right now. But because of, I think, my diet and how careful I am about these things, I'm able to have a very full life.
That is actually a story of redemption then, isn't it? I mean, you came to terms with the inadequacies of the medical mainstream medical community. I mean, you came out of medical school with this
Right.
already.
Mm-hmm.
That is amazing. So did I'm just curious, your colleagues, your professional colleagues, how did they respond when you were questioning these things? And then did they ever get back to, oh yeah, that one was taken off the market. You were right about that. I mean, what is it like in that community?
That is a good question. When I was going through my experiences, it's not something that I thought of, oh, this is the medication. It wasn't until like 15 years later when I thought I haven't heard of this drug for a long time that I went back and researched and found out that within a year of me being on it, it had been taken off. And so that being what it was, when I first started suffering the weakness, it was right after I took the drug, but I was so naive. I thought, oh, I'm sure I'll get better because I was a healthy person. And so in later years, as the weakness developed more and more, it's not something that you automatically go back and say, oh, it was for sure that drug. It's just that, to have the level of weakness that I did, to be able to put a time frame on that, and then to go back and know, oh, that medication was taken off the market. And not only that, the entire class of fluoroquinolone antibiotics was given a black box warning by the Federal Drug Administration because it is now known that it is a dangerous type of medication in general. And so a lot of doctors are not aware of that. Even my mother was put on ciprofloxacin, and a month later, she developed pretty bad arthritis. And her orthopedic surgeon told her that it was related to that fluoroquinolone that she was put on. But how many people will go back to their doctor a month later 2 months later and say, I've had problems. And someone will think to ask them, have you been on a fluoroquinolone? You know, it won't happen. And so I think that there are going to be a lot of people who may not be able to put their timelines together and don't understand those things.
Yeah, I think there probably in the last 3 years or so, there's become an increasingly high, healthy degree of skepticism for not the trust everything that comes out of federal regulatory agencies and the medical academies and journals. So you seemed like you were kind of predating that, and folks are coming along with recognizing the benefits of what modern medicine can bring in acute situations, but also not you started studying into food sensitivities, and I want you to talk about that, and even how a lot of people who teach on lifestyle medicine might be missing that
Right.
piece, and how the Lord led you into med missionary, really bringing that element in of
Yes.
particular food sensitivities on otherwise healthy foods. How did you figure that stuff out?
Okay, I'm going to try to write down the things that you're asking me, because I'm realizing that sometimes when you ask me a question that I can go off on a tangent a little bit and not answer your question. Because now that you asked me this, I'm remembering you asked me, how did the other people in medicine feel about the things that I was saying? So first of all, I just want to say that when you are going through a weird health type of situation, you normally cannot talk about it, because when you talk about something and it is so outside of somebody else's uh, life experiences, it comes across as weird, and it comes across as, maybe there's something wrong with this person. And so many of us who are struggling with these things, there's not that many people we can talk to, because your doctor doesn't have an answer for you. And if your doctor doesn't have an answer for you, typically they think that you're just a sensitive person. And then your family might just be concerned about you, and they might not, they might, because nobody else in the family may be able to understand. So a lot of us, we're just thinking that that's what I did, is I was just like trying to figure out what is going on. And I would every year or two, I would have a new crisis that would come up, and I would think, how am I going to work? How am I going to take care of myself? And so I was very highly motivated to try to figure out a solution to the problem. And I was also trying to figure out how to do this outside of conventional medicine, because I knew that within conventional medicine, because I'd gone through it, there was nothing there for me. And so I was praying about how to do this. I was learning much more about lifestyle and medicine. I was really working with patients. I was doing programs in my church. And then I realized, within my church, all these lifestyle programs that we have and this kind of thing, I'm not getting better. I'm having a lot of problems still. I have so much pain. My biggest things were pain. I was diagnosed with fibromyalgia. And of course, there's a stigma that's associated with that. And I did not want that diagnosis. And so I denied it for most of my life. And I was just really praying about, Lord, what do I do? And in 2011, 11, that time, I was reading a book about food sensitivities. And I thought, that sounds very intriguing, but it'll be expensive for me to research into. I didn't have the money. And the other thing was that it would require me to give up foods that I liked. And I didn't want to do that, because I already was on a whole foods plant-based diet, and I didn't want to do anything that would restrict my diet anymore. But then a medical student told me that there was a functional medicine doctor working at Loma Linda, where I was working part-time. And so I went and visited this functional medicine doctor, and she tested me for food sensitivities, and said, you are sensitive to pretty much everything, and you have leaky gut, You have, she had tested me some for, things like MTHFR. I don't know if you're familiar with that, but yeah, probably a number of your listeners are. And so I started learning about this whole other area of medicine that I'd never heard of before. And that's the first time that I really started even thinking about food sensitivities, 2011, when I visited a functional medicine doctor. Have you heard
Well,
of functional medicine doctors?
yes, yes. That was kind of the door, the window that opened for you to dive deeply into this topic of food sensitivities. And I want to jump forward with you. Just I can't help but say this, and I want you to keep going. But Hashimoto's, my wife, and I don't remember if it was you guys that she learned it from. I know we've been in touch, and you've had me on your med missionary. You
Yeah.
guys are doing great work. And she learned somewhere, drop the gluten. Just
Yes.
try dropping the gluten. And within a short window of time, she was able to cut her thyroid medication in half just by that one act.
Yes.
So I don't mean to spill the beans and steal your thunder. You got a lot more to say than just that, I'm sure. But what did you discover? And then you've been helping people with this. So tell us some things that people have done as you've led them through this food sensitivities journey.
Well, that's an interesting thing. I think sometimes people think of lab tests and they think that they think that it's very, very exact science. And so you have to know with food sensitivity testing, there are all kinds of different food sensitivity tests that can be done, and they may show slightly different results. And so you have to take everything with a grain of salt. You have to understand some of the principles that are involved, and just be willing to try different things out and see how it impacts you when it comes to food sensitivity testing. So there are some people who maybe they just have to drop gluten and they're okay. A lot of people, though, they get so very toxic and they get so very sensitive to so many different things that they have to pretty much stop everything and be on a very, very sparse diet, build their gut back up before they can reintroduce certain foods. And there are certain foods that we would not ever reintroduce again, just based upon the principle, believing that there are certain foods that you're just going to have the same problem all over again. So your wife, very fortunate. She might do even better to, look into other foods that may be contributing to the issue and that kind of thing. And we have had that. So this food sensitivity thing, it can be simple. It can be more complex. We humans are pretty complex creatures. I myself, I was sensitive to even stone fruit. I was, and you'll find that your microbiome, this family of bacteria, viruses, and fungi that live in your gut, that it will change over time. It'll change day to day. So there might be foods that you're sensitive to at some point that you might not be at another point, and vice versa.
That's interesting. I didn't know that part. Now, a
Yeah.
lot of the functional medicine prescriptions on the food stuff has that been going in recent years more advocating people you got to be paleo to be able to handle these things? And what has been your take on that? And what are your recommendations on the general diet philosophy? I heard you mention earlier whole foods, plant based. Give us a little insight into that landscape of the discussion.
Yeah, it can be very confusing. When we first started out, I was going to a lot of CHIP programs. You're probably familiar with the CHIP program. It used to be called what was it? The Coronary Health Improvement Program. Then it changed to the Complete Health Improvement Program. And I used to help with a lot of these. It's like a month-long program that you do in your community. People come twice a week for a month, and within just a matter of a couple of weeks, their cholesterol levels are better, their blood pressures are better, their blood sugars are better controlled, and it's quite amazing. And it used to be that I remember they would say, don't even talk about organic, don't even talk about GMO or anything like that, because these people are just they're making a big enough change as it is. Don't overwhelm them. Let's not make it hard for people. Um, But I think that was something that, the health message is progressive. Back in the 1990s, when GMOs were first starting out, when, Roundup was just starting to be sprayed on everything, I think it was a different time than it is today. So we were coming into it in 2011, around that time. Mercy and I wrote the cookbook, the Autoimmune Plant-Based Cookbook in 2019. And so around this time when we were going through our journey, there was considerable stigma against people with food sensitivities because the people in science were saying they didn't even know if there was such a thing as gluten sensitivity, and so there was a lot of confusion. So for us to be doing this, it was either we stay within the lifestyle, the traditional, the laws of health, just eat plants, don't eat processed, read your ingredients, this type of thing. And that's typical whole foods plant-based. It's like there's vegan, which can be pretty unhealthy, whole foods plant-based, which is like, you're going to get all of your nutrition from whole foods and not as much processed. So it's better, but maybe not necessarily organic. And they don't really talk about chemicals and this kind of thing. And then when we had our problems, then we learned about functional medicine. Functional medicine is mostly evolutionary medicine, which is where you eat according to how you evolved. And 2.5 million years ago, according to the evolutionists, when the paleo man came on the scene, he didn't know how to do agriculture. According to that philosophy, agriculture is the worst mistake humans ever made. And so we have to eat according to our evolution, which is that we hunted and gathered. So we eat meat, bone broth. We'll eat a few berries, maybe a few seeds that we caught along the way, but nothing like grains or dairy or, things that we would have to farm or that type of thing. And so those are the basic principles. And this is where we found ourselves when we got into all this.
I like the distinction you drew between, moving toward a whole plant food diet, which is healthy, to taking the next step, um, looking at organic, looking at non-GMO, and again, my wife and I were the crazy ones 20 years ago when we were like, you realize the kind of pesticides and chemicals they're spraying, and the preliminary research on the GMOs that's coming out, and people are like, you guys are nuts, but. Actually, that's mainstream. I like how you called it earlier conventional medicine because the mainstream has now shifted on diet, on treatment of disease. And I think your point of view really is the mainstream one now. When 15 years ago, 13 years ago, when you were studying this in 2011, it seemed fringe and eccentric. And so, if any of the listeners are like, yeah, we've been called crazy too, we know where you're coming from. But then reality catches up and we can bring everybody on board without gloating and just help people with this. And so, I also like the distinction you had between the paleo is really an evolutionary philosophy behind it. And I know a lot of our Christian audience has more of a creation worldview. And so tell us about that whole plant food diet, with the organic and with the non GMO. Why is that preferable in general? And then why is it preferable for your patients, for the people you're helping with their autoimmune conditions?
So that is a very good question because there are a lot of people who are adopting a paleo diet and are getting better, right? That was really confusing for us. And I'm sure it is for a lot of people because there are a lot of people within the Christian faith, within the Seventh-day Adventist faith, who believe that you're eating a diet that um, that is more in line with what the Bible would advocate for. And so when I first started working with people in the church, in the community, trying to help their faith in God grow by understanding these principles, it was kind of a confusing thing. Why are so many of God's people sick, myself included? And why are people seeming to get better on a paleo diet? Um, I think part of it is that, as I told you, when you are on a plant-based diet, there are all kinds of different things that you can eat and still call it plant-based. And I think that many of us don't know what has been happening in agriculture in the last 50 years and the impact that that may have on our different systems. I think that's one aspect of it. Um, I think that over time that, there's an epigenetic component. So we have not only agriculture and what's happening with agriculture with increasing levels of Roundup being sprayed on all of our fields, right? And glyphosate, as you know probably, Scott, it has not only been patented as a weed killer, it was first patented as uh, that pipe cleaner. It was first used as a pipe cleaner because it binds up minerals. It will inactivate magnesium and calcium and these other minerals that we need. And the third patent for it is that it is an antibiotic. And so if you think about that and you think that every single conventionally grown field of beans and grains and whatever other fruits and vegetables, uh, possibly, there are other fruits and vegetables that are being treated with these things. And how that might be impacting the microbiome of each person that's eating it and what that is doing to the next generation that comes along. Then you have medications, you have antibiotics that have come on the scene, you have foods that are being produced with preservatives. I mean, how is it that these foods can last in your shelves for so long? And so what impact is that having on this microbiome of ours? And how is that impacting future generations? So I think as we're thinking about this autoimmune epidemic, we don't understand, I don't think, the impact of all of these decisions of the generations before us, what it's having on us. And yeah, now I'm forgetting the question that you
Well,
asked me.
no, it's good, Dr. Joyce. I think I've got a new way to frame the dietary recommendation. You set me straight if I'm not on the right track with this, but you have this paleo concept of this evolutionary diet that preceded the Neolithic agricultural revolution, which you said, according to that theory, this is the worst thing that ever happened to humanity was, figuring out agriculture. But messing up agriculture over the last 100 years has done so much of the damage that you're describing. So maybe what we need is the Neolithic diet. The Neolithic meaning the original type of agriculture that mankind was doing for thousands of years before we messed it all up with all the chemicals and the GMOs.
Right, right. And so when people go on a paleo diet, typically they're on a standard American diet, which is pretty unhealthy. And so when they go on a paleo diet, it's going to be considerably better than what they are doing. And so a lot of people will get improvement. Typically, when you're doing functional medicine, you have to do a lot of supplements and that kind of thing as well. So what we've found is that when people are on a paleo diet and they go to this particular plant-based diet, what we do for our cookbook and the course at Med Missionary, we're super, super careful because we have a lot of people who are, some of them are near death, and so we are cutting out anything that is questionable, and we're trying to put in all the things that are going to bring life and vitality, because we really believe that every single thing you put in your mouth, you want to make sure that it's going to affect good change.
Absolutely. There it is. I don't know if that showed up and I missed it, but you mentioned the cookbook, and I told Jeremy on the back end, be sure to let listeners know how they can get Dr. Joyce's cookbook, the Autoimmune Plant-Based Cookbook. So
Yeah.
you can be healthy and heal simultaneously. I added that. I don't know if that's your preferred way to explain it, but I think that that is an excellent, excellent resource that you guys provide. And I got more questions for you, but already at this point, people are probably thinking, okay, I've got this condition, that condition, that's an autoimmune or a sister or a mother or a brother. How do people get a hold of you? I got more questions for you, but how
Right.
can people get your counsel, your advice? Where do they find you? Is it medmissionary.com? Is that the best place to find you?
Yeah, we have a course. It's online. It's at medmissionary.com. And we're going to start our next course November the 24th. It's a 2 month long course. And so that's one way that they can interact with Mercy and myself. Mercy is my partner who helped write the cookbook, and she has a lifestyle center that I visited in 2016. That's how we started working together. And she's the one that comes up with a lot of these innovative ideas for cooking and putting these different foods together. So that's, and also at YouTube, we're on Med Missionary, and we try to share their programs that will help people who are interested in increasing their knowledge about health as well as their spirituality.
Excellent, excellent. You guys have a big following for a reason, I think. Now, you were talking a while back on the food sensitivities topic. I've got two questions for you. You can take them in whatever order you want.
Okay.
One of them is, you said you to figure out what foods you are sensitive to. It's not always through some sort of testing. I've heard it. I think this is what you're referring to. I've heard the phrase like an elimination challenge. So my first question is kind of walk people through what is the process that you will teach them for how to figure out your food sensitivities that might be contributing to an autoimmune condition or something else. So what is that process of determining your food sensitivities? And then the other question is, are there things other than foods to be thinking about? Environmental toxins. When you start talking about glyphosate, my mind goes to fragrances and not only the artificial ingredients in the food, but the stuff in our hair and hand care and soaps. And my wife and I, like I said, we kind of went down the granola route 20 years ago, and we got all the special soaps and filtered our water, and we got the hand sanitizer here because I think it's crazy that we're spraying our hands with alcohol and it just smells terrible. Like, this cannot be healthy doing so much of that. Use a natural product for that. So many good options. So you can take those two in whatever direction you'd like, whether you want to talk about the environmental toxins or talk more about how to figure out your food sensitivities.
Okay. Oh, well, let's talk about food sensitivities. Mm. I think that the reason that we talk about food sensitivities is we have discovered, I don't know if you're familiar with the works of Dr. Alessio Fasano. He's a researcher at Harvard, or he was when he discovered zonulin. Zonulin is the protein that is produced by the intestinal cells when you have an infection or when you eat something like wheat and you're exposed to gluten. And he discovered that when the body comes into contact with this gluten, that it will cause your intestinal cells to lose the tight junctions that they have between those cells. And it depends upon your genetic makeup for how long those tight junctions are going to be lost for. So what will end up happening is that you no longer have that protective barrier there. And so then you will have undigested food particles, bacteria, viruses, things that shouldn't be getting into your body to get in through that leaky gut. And that's what we call gut permeability. That is what contributes to the food sensitivity and the reactions that you'll get because of those food sensitivities. You will have increased inflammation, you'll have pain, arthritis. Some people will have brain fog, fatigue, and these types of things. So you can have different manifestations from food sensitivities. Some of the things that people will do to assess for these food sensitivities, well, some people recommend like just checking your heart rate. Sometimes after eating certain foods, your heart rate will go up. And there are even physicians who recommend that if you have an arrhythmia of any sort, that you stop eating gluten. And I developed an arrhythmia due to dysautonomia during the whole last 4 years. And I know that there are certain foods that I normally can eat at certain times that I might not be able to tolerate them and they'll contribute to an arrhythmia. So that's one way to assess. The other thing that you can do is you can actually get testing done with a lab, and there are different types of tests that can be done. They can either check your blood, looking for IgG. They can test your mucosal tract, testing your stool for IgA. And sometimes they'll test your, I think they test your white blood cells, they test your actual blood cells to see how they react to certain foods. And so, some people will poo-poo these things. But I think, it's just data points. Look at the results and see if you make some of these changes, if it impacts your health, and it might be a good place to start.
Yeah. Yeah. So there are a lot of tests. And do you also take things away that are common food allergens or common irritants
Yeah.
just to try and see if it changes your symptoms? And so you like an elimination challenge. Is that something you do with people too?
So that is exactly what we do with our course and our cookbook. So what we're doing when people start the course, we just ask them during this 2-month period of time, if you can just eat this way and see how it impacts your health. And then after that, we can try reintroducing certain foods. And so we have had what we do with our cookbook. We have no grains in the cookbook. We have no GMO foods. So we won't include things like soy or corn because they are over 90 some percent genetically modified. We have no oil in the cookbook just because oils, even that are plant-based, they are more vulnerable to rancidity and oxidation when they're outside of their food matrix. So there are a number of things that we have done in our cookbook. We especially recommend that you soak and sprout your ingredients, and we have found that in a lot of people, because that increases nutrient availability and it decreases the phytic acid and other inflammatory anti-nutrients, we have found that this way of eating, if someone doesn't have a chronic disease, it will at least cause them not to have to spend so much time and energy digesting, and they'll have a lot more energy. Um, we had one lady who was taking our course to help someone with Parkinson's disease because this friend with Parkinson's couldn't cook for himself. And so she and her family was doing this so they could cook for this gentleman. And she and her family thought, well, if this is so good for this man, why don't we implement this for our own family? And she was a chemistry professor, interestingly, and she did this and found out that during this time she was doing this, the allergies, she had terrible seasonal allergies. And she said that during the allergy season, she used to have to stay in her house because going outside was just so painful for her. And she said that because of the way that she was eating, her allergies, she totally did not have them. And so there are people who will take our course and, they will implement the principles and then they find out, oh, I had postnasal drip and now it's going away. I had this condition and now it's going away. And so, yes, we do an elimination diet for our cookbook and our course. And then as people get better, then they can start reintroducing certain foods. And in the course, we teach people how to do that.
So as you've eliminated these things and you're taking 2 months to be on a very, a relatively restrictive diet to heal, the idea is to heal your gut so that you can later then reintroduce some of the foods that had been problematic and then the body can actually handle them once you've healed. But
Yes.
is there some degree of, like, my wife just stays off gluten, is that sometimes an outcome also where there's certain foods when you reintroduce it, you notice symptoms coming back and you say, now I need to stay off that one and that one in perpetuity, basically?
Yes. So we don't recommend people to get back on gluten. Um, we are going to be more maybe conservative than some people. We are going to recommend that people, for the most part, we recommend not getting back on any GMO foods. And even if they're, it says that there's no GMO just because of the risks of cross pollination, especially for people who, have cancer and really, really, severe disease. We just don't think that there's a need for that risk. And our diet, although it's restrictive from the point of view that it's not the foods that maybe you're used to from your childhood. Uh, at the same time, a lot of people are eating pretty much the same thing for breakfast every day. They're eating oatmeal and then they eat a sandwich or something for lunch. And so a lot of people, even though they think that we're restrictive, most people eat less variety than probably we do. We have a lot of variety in our cookbook. It's just that it's different food types than what people might be used to.
Yeah, that's fair enough. The word restrictive might feel that way at first because it's the not this, not this, not this, but you're discovering five more things to replace those three, right? Or the
Right.
same kind of thing just with different ingredients
Yeah.
that you're using better ingredients than the gluten and so on. So that's very interesting. And as I was thinking about also your cookbook as a 2 month period of time, have you found that people in the course, rather, for the 2 month period, have you found that people at the end of that say it was worth the sacrifice? Because you're going, oh man, I'd rather just deal with this. Some people might just throw up their hands and say it's impossible to really go that route with dietary, eliminations. How tell us about some of the experiences of some of the people who go through your course.
Well, some of it, the more severe cases, they do the course, but they might have some coaching done with Mercy as well, because when you implement these things and you're very, very sick, you might need a little bit more hand holding. You might need to tweak things here and there. I remember there was a lady who was in her 80s. She was 88 or something years old, and she was very, very malnourished because she couldn't absorb any of her foods. So she was 5 foot 5 inches and she only weighed like 88 pounds. And so she was someone that was near death. For her, and she'd been to a lot of other lifestyle centers. And as I said, most lifestyle centers don't believe in food sensitivities necessarily. So we've had a number of people who have come from this kind of situation where, in this lady's case, we started this type of diet that is whole foods, plant based, uh, learning to cook this way, learning the importance of consistency, because if you say you do this for a week and then you go to potluck at church and you think, okay, I've been doing this for a week, I think today it's going to be my cheat day. You don't realize that it'll take your cells a whole other week or two to recover from all of this, and you'll never heal. And so we teach people the consistency of this. In her case, we also had to blend all her foods, and doing this, she was able to get back up. She was, within a couple months, she had gained 20 pounds. I think it was it was a few months that it took her to gain about 20 pounds. And so she said she felt like someone in a concentration camp to getting back to fairly normal weight. And so I had another lady. I was I was a speaker at a camp meeting, and then I came back to the area to speak at a church. And during the bathroom break, I heard some ladies in the bathroom, and they were asking each other how they liked the program. And I was not sure if I wanted to be part of, the discussion, but I heard them say positive things. So I came out and I saw that there was a lady. I found out she was like 90, 94, 95 years old. Uh, she had been doing this program since she heard me at camp meeting, she said, when she'd been losing so much weight and she didn't know what to do and her doctor didn't know what to do. And she started doing this with the soaking and sprouting. Back then when we did it, it was harder than what it is now because we figured out how to make it even easier than it was back then. And she said, now I've stopped losing the weight. I told my doctor I know what to do now. And she said, now I'm going to focus on gaining weight. And so, yeah, it's even for people in their later years, it's not something that they can't do. And so I've been very encouraged. I remember Mercy when I first wrote this cookbook, we published it, and I was talking to Mercy, and she said, Joyce, someone called me, wanted to come to the Lifestyle Center. Her Lifestyle Center is called Years Restored. You can find it at yearsrestored.com. And she said, I asked them how they found out about me. And she said, well, my friend bought the cookbook and she's been in a wheelchair and now she can walk. And I thought, that's amazing. I sometimes when you do this and you don't always, there are people that think that maybe this is too much. Maybe you're asking people to do too much. And that's not my desire at all, But when I hear these amazing stories of people who've been on healthy diets even, and they're really, looking for what to do, they're near life and death, and to see these simple changes, they might take time, they might not be the easiest things to do, but they're simple and they're safe, and they can give someone back their lives.
I love the stories of the particularly elderly people. If it's worth it to them, I mean, I'm thinking I'm that age. Most people are like, I'm just going to punch out and ride into the sunset. I don't make any dramatic changes in my life at 85 or 95, but that's worth it to them. Those stories, I think, answer the question better than anything you or I could say.
Yeah.
I want to talk about environmental toxins still,
Yes.
but one thing I want to clarify, when you were saying avoid GMO foods, I think most listeners are like, yeah, I'm avoiding eating GMOs. I make sure to eat organic or at least non-GMO verified. But I think your reference there was you said the cross contamination makes it such that the non GMO verified label might not suffice if you're eating corn, soy. What are the big offenders of the GMO
Well,
crops? I mean, we eat organic corn and soy and potatoes and stuff, but you're saying maybe if you've got these sensitivities, you want to be extra careful, even eating the organic and the non GMO versions of them.
you might want to be. I It's just, especially if you're someone who is very sick, uh, it's just not worth it, in my opinion, to wonder, oh, I wonder if this has been cross-contaminated or not. Because in my case, um, I ate this way for about a year, and then I had a friend come and visit, and I thought, oh, my friend is not going to want to eat my food. So I went out to eat at a Thai restaurant, and I asked them, please, could you just not have any gluten and this and that? And um, as I was going home, driving home, it's I have a lung condition, and so I could feel myself breathing, and I thought, this is not worth it for me. So I think that was one of the last times that I went out to eat. I have found, like, even when I was starting this elimination diet, and then I did a program at the church, and I made a salad dressing. And the only thing in that salad dressing that was not a Whole Foods type of thing, it was this Bragg's amino acid. And within minutes of doing that, eating it, because I was like, oh, I'm just going to try it. Um, all this pain came back. And I just realized one ingredient can cause so much inflammation for people. People don't realize that. So that's what helped me to understand, like, during the whole 4 years that we were doing natural remedies, a lot of people were interested in natural remedies in our group. And this one doctor was helping her family member, and she said, my family member was getting better, and then all of a sudden today he's crashing. And I asked her, I said, what did your family member have to eat today? And she said, well, my parents came by and they're Korean, and they dropped off these gluten patties, and you're going to eat them with soy sauce and that kind of thing. And I just from my own experience, I thought, oh, that's probably what it is. Because, Scott, you know, the curse does not come without a cause. And so when you see people getting better and better, they should be going in a good direction. For them to come down, you have to look for why that might be happening. And I have just found it can be just one ingredient. It can just be one type of food, and you won't know. Most people, they have no idea of the impact of these things because they're not paying attention.
Well, you've given us some good insight on diet, and then there are the things that go in through our skin and our nose, and the environmental toxins in general, not just products, but places that we find ourselves. Give
Yeah.
us some of the big offenders there, stuff that we can actually do something about.
Right, right. Well, I think people should start out by realizing that there are anywhere from 1 to 2,000 new chemicals that are being produced and released into the environment every year, and they are not required to test them for human safety before they put them into cosmetics, furniture, clothing, and things that are going to touch you. And so it really behooves each person to think very carefully about what kind of cosmetics we use, uh, what kind of lotions we put on, what kind of furniture we have, and even the hand sanitizers you were talking about with your hand sanitizers. What kind of ingredients are going into this? It was just a few years ago that they took triclosan off the market because they there was enough uproar in the community, enough people saying that this is an endocrine disruptor, and it was taken off the market. But how many chemicals like this do we have in things that we use on an everyday basis that we are not thinking about, and we're waiting for the government to do something about? And they might take triclosan off just like they took BPA. BPA, everyone's like, we don't do BPA, but now they're doing something else and they haven't studied that out yet. And so it really, really is something that we all need to think about as far as these environmental toxins. Did you know, Scott, that up until there was a doctor by the name, I gotta see if I can find it. I think his name was Bostich. Bostock, John Bostock. He he read a paper to the British Society of Medicine in 1819, and he described this curious case of someone with like runny nose, itchy eyes, and this kind of thing. It was the first description of hay fever, 1819.
Wow. That's incredible. When you were talking earlier, Dr. Joyce, about the person whose hay fever went away, their seasonal
Yeah.
allergies, you called it, that is amazing. I mean, that's the great big mystery. We had a guest on LSR last week. It's like reversing type 2 diabetes, no sweat, right? Allergies, though, that's a tough nut to crack for most people, and that's something you guys are actually able to penetrate this challenge. And the historical fact you just shared, by the way, I don't want to be missed by the listeners. The first known description of allergies, which what percent of kids today are suffering from an allergy to
I think
something?
1 out of 5 or
That's
something.
unbelievable.
I
That
think
is,
if 1 out of 5 adults, I can't remember now. But if you think about it, most of our diseases are going to start with the immune system, right?
yeah,
So
yeah.
like allergies, it's the immune system. It's not able to say, oh, I shouldn't be sensitive to that dust or to that tree. I mean, like I kind of, you know, I think like when the Lord put Adam and Eve into the Garden of Eden, uh, were they like, oh, hold on, this is my mom. Hi, Alma.
Yeah, I like this go back to the question of the creator. What
Mhm.
was his intention for mankind? And we've messed it up. It's man-made stuff. It's not God's doing. And yes, he cursed the ground for man's sake and made it difficult for us to hoe the ground for make us sweat a little bit for our own good. But that's not disease that has been brought on by what we've done to ourselves, and the devil. He knows how to manufacture these things, and design them. And um, by the way, there's a book that we got to be careful on certain platforms to talk about this certain word that a lot of people do with their children, like 68 times in the first so many years in mainstream medicine. And this doctor was looking at the population of the children who had undergone those treatments versus those who hadn't.
Right.
And one of the things that he know, because he had his own client list, his own patients. You know who I'm talking about. I don't remember his name, but basically he said, let's look at the health outcomes of the kids who are versus and actually allergies was one of those things where it was worse for those who had participated in the recommended doses of
Well,
childhood treatments.
that's an interesting thing because for you to develop autoimmune disease, you need three things to happen. You need to have a genetic predisposition, you need to have leaky gut, and you need to have an inflammatory trigger. And that inflammatory trigger can be a medication, even in the form of an injectable. And for me to say that even years ago when my book came out, I was on a podcast. I was going to be on a podcast, and the interviewer said, "But you know, I see that you have as an inflammatory trigger these injectables, but haven't we established that they're safe and effective?" And I said, well, maybe so, but they have been associated with triggering autoimmune conditions. And for that, I was not allowed to be on that podcast. And so, we have to understand that science, we have to follow science that is in search of truth. So, yeah.
Yeah, absolutely. Now, just before we close, on the topic still of the environmental toxins, can you give us a couple of action items? Because that's a topic that can be so vast and feel so impossible to conquer. And it's like, you can make little decisions here and there. What are the biggest offenders and the biggest things people can do to limit their exposure to environmental toxins?
Well, maybe I'll just share the things that I do and maybe that'll be
Yeah.
helpful. I really try not to use anything in my home that to clean my house, for instance. I use vinegar, I use baking soda. I don't use real harsh chemicals and that kind of thing. I don't use fragrances like perfumes. They call fragrances the new secondhand smoke. These fragrances are made in factories where they're not concerned about human health, and we don't understand the safety effects, and they can have multiple ingredients. And so I don't use those types of things. I don't use foods that, well, I cook all my own foods and I do it pretty much from scratch. But if it's in a box and it says natural flavors and that kind of thing, I would really try to avoid those things. A lot of those are made in perfume factories too. And and then as far as lotions and this type of thing, I try to stick to oils, as far as caring for my face, for instance. A lot of women will get very expensive cosmetics and that type of thing. And so I really try to use all natural types of things, olive oil, almond oil, jojoba oil, mixed with some essential oils, all kinds of natural things that can be done. I use comfrey oil, and so that's a start for me. Scott, you're probably a lot further along than I am.
Oh, I doubt that. I appreciate Dr. Joyce. Oh, yeah, the castor oil. That's another one. That's a Living Springs product. You want to get that. That stuff is awesome. I see Dr. Joyce, her face lit up when she saw that there. That's one of your favorites, too?
I do use castor oil, but I do have to say it takes a lot of discipline sometimes to do some of these things. Castor oil is a lot heavier, and so like I have found that I'm not doing it as much as some of the other ones, but yes, I do have a lot of it in my house.
That one is, if not the bestseller, certainly a bestseller at Living Springs. People love the castor oil.
It's
Well,
so helpful for those poultices and that kind of thing. It does make a difference.
yeah. Well, it's got so many uses and functions from skin and to everything that you're describing there with the poultices, you name it. So I guess we're going to wrap it up there, and we're not going to go to live Q&A tonight. See you on our next live stream as Dr. Walt Cross from the Mustard Seed joins us to discuss medical missionary. Isn't that an interesting thing? We're just finishing up our conversation with Dr. Joyce from medmissionary.com. We get to talk more about this work to reach people's needs and meet their needs and bring healing. So we'll see you all next time at 7 p.m. Eastern on Wednesday. And thanks to our producer, Christian Digital Network. Great job again, guys. From likes to lives changed, please scan that QR code and subscribe to CDN YouTube channel. Don't forget to look up Dr. Joyce at medmissionary.com and visit, as always, that LSR store to keep what we're doing moving forward and keep supporting yourself and your family with healthy products. I'm Scott Ritsema, your host. Thanks for joining us, and we will see you next time on LSR Live.